When doctors start to worry more about liability than they do about the case at hand. So, we talk about doctors, and there's a saying in medicine that when you hear hoofbeats, you don't think of a zebra, you should think of a horse, right? Zebras are going to be rare to see in Kentucky. But what happens is when you start having liability concerns, you think of that zebra first, and you'll order tests to look for things that are rare and that are improbable, just because if you happen to miss something, you're going to get potentially sued. And so you order the test for things that are probably unnecessary, that add a lot more cost to healthcare. You might admit someone to the hospital just in case, when it probably doesn't need to happen. We see a lot of that. And so I find it when I practice hospital medicine that there's a lot of our ER doctors who see a lot of patients every day. It's frankly easier for them to say, let's put someone in the hospital. I don't have to worry about the liability for it. When they don't really need to, they might sit in the hospital for 8 hours, go home the next morning, but the charge for taxpayers is very, very high. So it's ordering tests that are not necessary just to cover yourself, when instead, if you could just follow academic standards and know that can defend you in court, might be an easier system to go with.
So in terms of medical liability climate here in Kentucky, we've passed a couple things in the last couple years, right. But especially for you, there's more work to be done because we had a bill this past year, actually a couple bills that didn't see the finish line. So talk a little bit about those bills and what needs to happen next in Kentucky to solve our climate that we currently have.
Well, I think I'm particularly encouraged. I'll probably keep filing those types of bills moving forward. I got the sense, speaking to Chief Justice Minton, that the Supreme Court is interested in reforms within civil liability, which is very encouraging. And I had a chance to attend a conference with them in Arkansas with 3 of our Supreme Court justices, members of the defense and trial bar. Representative McCoy was there, president of the KJA. So individuals that I haven't had these kinds of conversations with, and some very good conversations. And I think they're interested in some reforms. They may not want to go all the way that I want to go with, but sometimes you need to start taking some baby steps in getting some reforms to occur. So I think they're open to having the conversations. I'm encouraged by that. I still think there needs to be some type of a potential and ability for the General Assembly to set a cap on non-economic damages. The question is going to become how high that cap is. I know the argument is that you only get very rare cases, so what if you set the cap where it covers 99% of the cases that are out there, but helps bring down the overall average of claims and helps us lower our malpractice insurance rates? Until we do something about that, we're going to continue to have very high malpractice costs for nursing homes, for hospitals, and for doctors. But when we start having hospitals being threatened to be shut down because of that, that's a major concern for any taxpayer, any Kentuckian. You start losing access to health care, that's an issue, and I think it's a reality. So we're trying to collect data. I think both sides are trying to collect data to sit down and find some common ground. And I think the attorneys are interested in having some reforms that'll make it easier for them to practice law, to expedite cases, and be able to, let juries do their work again. I think right now people are opting to get around juries because, frankly, the cost is so high and there's just no confidence in the system.
So like you said, obviously caps have a lot to do with the providers and insurers and so on and so forth, but what does it mean to the normal person? Because it's not only impacting our recruitment of doctors and people's ability to stay in business, right, but it also impacts normal people too, yeah, correct?
So if your mom has dementia and needs to go to a nursing home and the nursing home locally has shut down, where are you going to send your mom? Much further distance from where you're at, potentially. If you have a hospital that has to shut down because it doesn't have a malpractice insurance carrier, you're not going to have a hospital locally. That's a big deal. So costs go up for that. Not having as many providers around makes your costs go up for care. It's access to health care. All those things become a factor. Other states have had the foresight to see some of those things and have put some reasonable caps in place or things to help alleviate those problems, and so that people can enjoy health care that's going to be more affordable and have more providers closer to them. It's also an employment issue. Our hospitals, our nursing homes, medical practices employ a lot of people at pretty good wages. You start to shut those down, those are people without jobs. They have to rely on the public system to stay afloat. So I think all of that becomes a factor just from a business perspective. And even just non-medical, I think all of our businesses in general, this goes beyond just medicine. People always think, well, he's the doctor in the General Assembly, so that's what matters to him. It becomes a business issue, and we have a lot of our businesses in the state that are begging for some relief, just to be able to, again, have some predictability within the system and know what to expect. By the same token, we want to preserve the jury system. We want to preserve justice for people that have been wronged, but it needs to also be reasonable. And I think when we have certain bad players in the legal system that have created an industry for lawsuits, really, that's been the problem. And I think even our legitimate attorneys in the state who practice law the way it should be practiced acknowledge that something needs to be done for these people that are kind of creating an industry and running away with a problem that's affecting everyone else for their own benefit. So I think there's going to be some common ground. We just need to find what that is, share some data, and we need to work quickly to get some of these changes in place. It's something that it's one of the main reasons I ran for office, was to get this done. And I think if we can do it and catch up with the rest of the country, Kentucky currently ranks second, I think, in most malpractice cases per capita. And our insurance rates for our nursing homes, I think, are 7 times that of our neighbors to the north. Just a lot of changes that have to take place.